Welcome everyone to our webinar. This is the complete guide to telehealth during COVID-19 all in one webinar. We're glad you're here with us today. Let's go ahead and get started. My name is Liz and I am the marketing manager here at AZCOMP Technologies, and I am joined by a host of panelists here today. There is going to be a lot of information provided to you today regarding telehealth and its position during COVID-19. A few key points we'll go over today are the telehealth waiver due to COVID-19, telehealth options, including live demonstration, documentation tips, telehealth billing guidelines during the COVID-19 national emergency, collecting from patients remotely, and best resources for information. I do just want to spend a few seconds letting you know that AZCOMP is really striving to serve you with as much useful and relevant information related to your businesses during this COVID-19 pandemic. We are spending a lot of time talking about and thinking about ways to help you, whether that's with telehealth options, communication with your patients and clients, information regarding the CARES Act small business loans, transitioning your team to working from home, and much more. If there is any other information we can get to you, please let us know. We partner with subject matter experts on a variety of topics, and we can bring those webinars to you. Right now, our intent is serving and doing anything we can for each of you. And we might be practicing social distancing in the literal sense, but we're trying to practice virtual closeness right now. We have the technology to do it, the ability to do it, and we're on board. A few housekeeping items before we get started here. During this webinar, we will have you set on mute. So if you do have any questions, please feel free to use the chat feature so we can communicate your questions at the end of the webinar. We will have quite a few moderators in the chat to get those questions answered during our Q&A. We do also want to remind you that this webinar is being recorded, so we will email you access to this recording at the conclusion. A quick disclaimer, although AZCOMP makes every effort to ensure that any of the information regarding billing guidelines are checked and accurate in both our documentation and training, it is still the sole responsibility of you, the user, to remain up to date on billing requirements and deadlines. Resources such as nucc.org and cms.gov are making updates rapidly during this COVID-19 pandemic. We are working hard to keep this information relevant, but many of you know changes are being made literally overnight. So please make sure you are still referencing those resources, checking any of the content provided here today. Okay, I won't take any more of your time, so let's go ahead and get started. I'll hand this over to Lori Olson, AZCOMP Customer Experience Manager, and she will go ahead and dive right into the expansion of telehealth waiver. Welcome, Lori.
Medicaid. And for private insurances, this is a great link that will actually give you a list of all the private insurances out there and the things that they're doing to implement changes and to help with COVID-19 and telehealth as well. So, just note that the information today is going to be directly in reference to to Medicare, but most everybody generally follows along what Medicare does. So check with those private insurances if you have, if you're billing those private insurance as well. So first we're going to talk about the types of virtual services. The first is telehealth visits, and that's where we're going to spend the majority of our focus today. But there's also virtual check-ins and e-visits, and it's important for us to understand the differences between those three. Because the reimbursement rates are different between those three as well, and the waivers are generally applied to the telehealth visits themselves. So in order for it to be a telehealth visit, what differentiates it from those other two is it has to be an interactive audio and video telecommunication that permits real-time communication between distant sites and the patient. So the keywords there are that it has to be audio and video, and that it's real-time communication. So we'll talk about in some of the other ones, you know, it can't be a recording that you're forwarding and stuff like that. That's covered under some of those other options, but for telehealth, it does need to be real-time. So what services can be provided? So the E&M visits, most of your office visits, mental health counseling, preventative health screenings are all covered under the waiver. In addition, on, I think it was March 30th, they also passed 80 additional services were added to that. So they've really broadened the number of services that you can actually do through telehealth. And there's, again, links down here at the bottom on each of the slides that we'll also make available with the information that we send out afterwards that will point you to where you can see the list of all those covered services. So what can you use? The President made it clear when he made the announcement way back in March 17th, 17th or 18th is when that came out. Feels like a lifetime ago already. But included in telehealth now, because I've loosened all the restrictions to be able to get this deployed as quickly as possible, there's a lot of different things you've probably heard about, like you can use Zoom or Skype or FaceTime. Those are all actually covered now under telehealth services, but we do want to note with that as well that the OCR has encouraged providers, one, that they need to notify patients if they're using any of those third-party products that aren't actually HIPAA certified, so that they are aware of potential risks that that they may have because of they're not up to the HIPAA standards. And as the latest notice that went out over the weekend as well, talked specifically about Facebook Live, Twitch, and TikTok, and some similar video communications should not be used for that. So that's on the do not use list. Not that I think anyone out there was doing that anyway, but it's good we always have that clarification. So ONC put out a list of HIPAA compliant vendors that they, basically going along with their recommendation, which is just that make sure, or they're highly recommending that you use a telehealth service that would be HIPAA compliant for you. And it, again, I think right now this medicine going forward after this is going to be changed forever. So telehealth existed before. So as your patients get used to it and things like that now, it's always good to consider what the long-term plan might be here as well. So choosing a vendor that is HIPAA compliant could really help you learn a system, get a system in place now, and prepare you for the future as well. So, so we're going to take a quick poll here and see if I can. You know what? I think, Liz, you might have to run that poll.
Okay, you got it.
We're just going to do a quick poll here to see who's using telehealth already and like what options that you're currently using to see. There we go. So that should pop up on your screen. And we'll give everybody a few seconds to fill that out. Liz, you'll have to let us know when it looks like we've got a number of responses so that we can go ahead and share that.
And we'll just give it a little bit. It does look like there are a lot of responses coming in right now.
Perfect, thank you.
Okay, we'll give it about 15 seconds.
All right.
Okay, so
maybe you can share the percent of people right now in our group that are currently using telehealth services already.
Okay, so we've got about 64% of our attendees right now using telehealth services. About 36% said no.
Okay.
It does look like about 12% are using FaceTime, 10% using Skype, 24% using Zoom. No one is currently using Google Hangouts or Microsoft Teams. 36% said an other source, and then 34% said I am not currently operating with telehealth services.
Okay, great. Well, I'm glad to hear that we've already got some good adoption there as well. So whether you've adopted or not, we'll have relevant information for you in the webinar. So appreciate you staying with us. All right, so who can provide telehealth services? Physicians, nurse practitioners, physician assistants, there's a whole list there that can provide those services. So they kept the same rules that were available before the pandemic. If you were qualified to do services before, then that to provide telehealth services before, then you are qualified now as well. They have not expanded that list, though. I should note that. So we can talk about that a little bit in just a second here. So the telehealth waivers, starting March 6th and through the duration of the pandemic, Medicare will make payments for visits all over the country. So that is unique. Prior to the pandemic, it was limited to rural health, and so there were some restrictions around that. That has been lifted. Reimbursements is allowed for any telehealth code, even if it's unrelated to COVID. So don't think that you have to only be using telehealth if a patient is suspected of having COVID or anything like that. The purpose, of course, of lifting of implementing these waivers was to make it safe for everybody, so that healthy patients that still needed to talk to their doctor and everything else weren't put at risk of being mixed in with sick patients when they're in the office. So another important point is that these visits are considered the same right now as in-person visits, and they're paid at the same rate as a regular in-person visit. So that is great news, because your reimbursements for office visits and things like that are going to be the same right now as they would be if they were coming to your actual office. So you can also work from the safety of your home if you need to provide telehealth services to your patients. I didn't mention on here either, but they did lift, you do not have to include your home address or register your home address or anything like that with them. You would still include just your office address for billing and things like that. So they've also lifted it before. It had to be with existing patients only, but now it can include both new patients and existing patients. And physicians can reduce or waive cost sharing for telehealth services. And they've also lifted so that if you are a physician that's only licensed in one state, you can provide services across state lines without going through the normal licensing process for that. So additional information that's relevant to the waiver. So they've also lifted some of the HIPAA regulations. So right now, during the pandemic, they are not enforcing the requirement to obtain a patient's agreement to speak with family members or friends, or the requirement to distribute a notice of privacy practice, as well as the patient's right to request privacy restrictions on confidential communications. So again, to ease the burden on everything that's happening so swiftly right now, they have lifted some of those HIPAA requirements as well. Another interesting thing to note is that for controlled substances, typically you need to see a patient in the office in order to, refill prescriptions and things like that for a controlled substance. So the DEA has put information out that says that you can, practitioners can prescribe for all controlled substances to patients whom they have not conducted an in-person medical evaluation for. So that means that that you will be able to provide those services during this time as well, and use telemedicine in order to do that. So It does need to, again, meet the telehealth standard of being an audiovisual real-time communication with an interactive system in order to do that. But that is important to note for anybody that may be concerned about how to take care of those patients during this time without having them in the office. So recently, it was also announced over the weekend is really when all the information kind of started making its way out after the announcement. But you've probably heard that and maybe you've experienced it already as well, that there may be a portion of your population that even if you have telehealth services available, that they just don't have the resources or aren't comfortable doing an audio video type visit with you. So in order to still provide care to those patients, they have also lifted or eased some of those requirements. And again, that's news that came out in the interim rule that was just made law. So I believe it was on March 30th. So you can provide telephone visits for E&M visits. However, the one thing that you should note is that you can provide them, but they're not going to be treated equal to a telehealth visit. So if you'll see in the notes here, they're given their own separate set of codes to use, and those codes are reimbursed at a lower rate. So you still would want to, if you can, provide the telehealth option with the audio video capability in real time, because that's going to allow you to provide the best care to your patients as well as get you the highest level of reimbursement for those visits. So I'm just going to briefly touch on the other types of visits and what's different about them. Virtual, you'll also hear as part of like the telemedicine, types of virtual visit. That's just a brief communication between practitioners. So what's different about that is that it can be over the phone, it can be through a video or an image, and you can respond through secure text messaging or an email or patient portal. So what's different is it's a brief communication that's not a real-time audio video type encounter. So just not much has changed with that over what was previously available before the pandemic, other than that they are expanding it so that both new and established patients are now included in that option as well. All right, and then e-visits are, again, another way that you can communicate with your patient. The rules and regulations around that remain practically the same during this time period. Those are more of a virtual check-in, so a way that your patient would typically initiate that through the patient portal, send you a message, and then you could message back or communicate through them in that way. So again, that's another option that's available that's really under like the telemedicine umbrella, but it is separate and different from a telehealth visit. And there's different requirements. So it has a little bit different requirements, as well as the reimbursement's going to be a little bit different. So I'm now having given you that explanation, you saw that there's different options that are out there on how you can do telehealth. So what we did is we've invited Megan from UpDocs to join us, and she is going to highlight just one of the options that's available out there for you that is a HIPAA compliant option. So I'm going to turn time over to Megan now.
Thank you, Lori. If I could just share my screen. Thanks everybody for joining us. That poll was great. It's nice to see that over 60% of you are already starting to adopt telehealth options, as they are critical right now in healthcare. So I'm just going to go over a brief demonstration of what UpDocs is currently offering. So if you have not heard of UpDocs, I'll give you just some brief background on who we are. We were started about 10 years ago by a neurologist who was really frustrated with the communication methods back and forth between providers and with their patients. So what UpDocs, our co-founders with Dr. Barbash, came up with was a single HIPAA compliant inbox to organize all of those communications and communicate efficiently, streamline all of the faxing, the direct messaging, all of those different things you're taking care of on a daily basis into a single HIPAA compliant inbox. As Lori mentioned, it is going to be very, very important as changes occur, as regulations get a little bit more lax, that we're making sure that when everyone is allowed to see each other again, and when you are allowed having more and more patients back in your office without risking them, we want to make sure that you do have a HIPAA compliant component available for those patients still. So with UpDocs, you have a HIPAA compliant inbox. We are integrated with over 150 EHRs. So chances are we're probably integrated with one of yours. And if not, you can use UpDocs as a standalone feature. We have signed over 2,500 practices up with our telehealth option in the past 2 weeks alone. We've supported over 2 million minutes of actual sessions, virtual sessions with patients and their providers. So obviously these are unprecedented times, and I want to make sure that I can show you guys something that really is already working for a heap of our customers. So as you can see, we're in the UpDocs inbox now. Again, this is where you would organize all of your chats. So what we call a video or telehealth session is a video chat. We are offering our telemedicine bundle right now for $49 per provider, discounted from $199. But really, this is including the video chat session, so allowing you to conduct those consultations remotely, and then also a secure text feature that will allow you to send attachments and securely text message in a HIPAA compliant way with your patients, with other providers, or even with your staff. So we're going to go up here to our toolbar, and we're going to start a video chat session. So what has opened is a HIPAA compliant browser that is limited to a single patient. So whoever you message within this browser, whatever patient you get on the line, this is their room essentially. So if they were at your practice and your MA took them into a conference room or a room, this would be technically their room. So we're going to go ahead and call one of our patients today, which is one of our lovely sales reps, Nathan Bell. And as you can see, I already have him as a patient within my UpDocs address book. So we have the option to either text message Nathan securely or email him. What we've seen a lot is that most patients prefer that text message. They're not typically looking at their email unless they're getting alerted to it, but 97% of Americans prefer text message as their way of communicating. So I'm assuming they probably have their phone near them. And if they are expecting your text message or expecting a virtual visit, they should have it up and ready. But we're gonna go ahead and text message Nathan. So once we've texted Nate, it actually opens up this window. This window allows Nate to have 10 minutes buffer. So your patient has 10 minutes to click open that link that they get securely on their cell phone and join you for your virtual visit. Hi, Nathan.
Hello.
So as you can see here, you can capture images. So if your patient for some reason has something to show you or you want to review something going on or some diagnosis you need to give them and you want to save that to the chart or you want to save that to your notes, you can take those images right there. You can also type in here any notes that you deem credible or that you want to go to the chart as well. Thanks, Nathan. And all of those images and notes are saved right here. We do have some providers who typically like to take notes during the call, but a lot of other providers we see taking notes after the call. You can do that as well. You don't need to make sure all of your things are typed in there right when you're talking to your patient. You do have follow-up time after the event to make sure all of your notes are squared away so that when they are sent to the inbox, they are as correct as you can get them. So we see here, okay, he's making a little bit of a face in that image. We don't necessarily want to save that to the chart or send it to the inbox. No worries, you can delete that screenshot very easily here. But once you've had your summary all concluded, you see that everything's accurate, you see you have the initiated by, so that will be whichever staff member is conducting the virtual visit. We have our participant, which is our patient, the duration, and then also the date and time stamp for the call. All of these details are important for billing, obviously, so you want to make sure you save those. And then we'll simply send that summary to the UpDocs inbox. Now, like I said, these rooms are only available per patient, so limited to one patient. Unfortunately, we have a lot of doctors trying to keep this window open and send an invite to multiple patients at a time, and they're getting errors. Unfortunately, you cannot do that. It's limited to one patient at a time. So we're going to go ahead and X out of that room. There's no need to keep that open. But as you can see, the little one here indicates that we have a new virtual visit session that we sent over to the inbox. We click that open and we use the hover feature to see that our summary notes are there. Our image is good. You can download this as a PDF or a TIFF file, or you can then send the item to the chart or send it really anywhere you'd like. Depending on what features you're using of UpDocs, you can send it multiple ways, or you could even send that summary if needed. Again, I don't advise this necessarily. With our secure text functionality, you can choose those images and that summary, click right up here to send a secure text, and send that to your patient easily and HIPAA compliantly. We create templates. You can attach files, obviously. You can allow responses with your patients, or you can turn that functionality off. It's really just dependent on preference. But this is also another feature that comes in the telemedicine bundle. And with that, you also have SMS Quick Send, which is a non-HIPAA compliant way of texting. So if you need to tell a patient you're running a little bit behind for your virtual visit, they have 10 minutes in that buffer room so they can stay on the line and wait, you can send that right here. And then once that conversation comes back, if your patient replied or you had a conversation back and forth with them, that will show up as a threaded conversation right here in the UpDocs inbox as well, which you can then either send to the chart, send to a secure folder, or just simply leave in the UpDocs inbox. UpDocs does allow you to archive and save documents for up to 21 years. So obviously we're in unprecedented times where things are changing from day to day, but you always have peace of mind knowing that your documents, your virtual sessions, all of those conversations with your patients, unless you really want to get rid of them, they will be here for you when you need them. I think that's all that I have, though, if you want to pass it off to the next presenter. If you guys have any questions, feel free to send them my way or put them in the chat option.
All right, thanks. We're going to turn it over to Maggie. We did have one quick question for you that came in, though, Megan, and that was about if there's an ability to add templates to the charting or summary. And I'm assuming they mean when you're taking the notes during the visit.
We don't have the option to templatize the notes or the summary notes yet. But with our secure texting feature and with the actual text message that goes out to your patients, so when you're sending them the virtual visit invite, you can template that to say exactly what you want and make sure that your provider name or your practice name is in there. But unfortunately, no templates for the actual notes. Not yet.
Great. And then we're going to turn it over to Maggie, and she's going to go over some of the documentation and talk a little bit more about how to pull that information into some of the EHRs that we support as well.
Great. All right. Thank you. And speaking of templates, that's one of the areas that I'll be talking about with you today. So we'll just kind of jump in now. First, I just wanted to piggyback on what Megan was just talking about. So if you're using a Lytech MD or Medisoft Clinical, those documents she was talking about downloading, your screenshots, your summary, you can add those directly into your progress note. So once you download the file that you want, I just have a little screenshot here so you can see. You would just go to insert that linked file and browse right to it. And what that will do, you'll see down here at the bottom, it's going to put a little P-link in your note so you could always go back and reference that. So there is a way to get that over pretty pretty seamlessly and attached to your progress note as well. For NextGen Office users, good news, you already have a telehealth solution included in your product. I've added a screenshot here so you can see the capability where you can be visiting with the patient face-to-face. You can use the chat feature, all while having your progress note open that you can be working on as you go through your visit. So setup is really minimal and pretty straightforward and easy. The portal's great, so if you want to get started with that and you're not already using it, we can get you up and going pretty quickly. Most practices are up in less than an hour, so let us know if you need some help with that. And now let's talk about just some general documentation considerations here. So when you're doing these visits, it's been recommended that you acknowledge that it's a telehealth visit in there. And then if you're using that 95 modifier, which we'll talk about, it's going to be saying you're using your regular 11 or whatever is appropriate for you place of service, but that 95 is indicating it's for telehealth. So you may want to consider putting something in there that says, the encounter is a telehealth session due to the pandemic, and that the patient consents. So just a few key things you want to get in there. Give you a couple of samples of chief complaints. Of course, you'll want to make it custom to what you're using there. Also, maybe not a bad idea to include the product that you're using for those face-to-face, just so they know you're not seeing your patients with TikTok. But you could put in UpDocs, or for NextGen, you could just say within the software. And so a couple of options for you there. Now for your physical exam, we're also going to talk about, for both products, ways that you can use what you already have, but make a telehealth template pretty quickly. But I just want to point out just a little advice there to take a look at the documentation you're doing in the physical exam. Make sure you're not putting anything in there that would indicate you've actually had your hands on the patient, right? So we can't do any auscultation, we can't palpate, we can't describe those sorts of things. So make sure you may want to adjust your physical exam just a little bit as well. Okay, so this next one, let's talk about selecting the appropriate service codes here. So there's a few guidelines that have been released. So right now, they've removed any requirement for the history or physical exam in your documentation for 99201 through 215. So that's going to help lift some of that. As we were talking about with the physical exam, if you are documenting, you can imagine without being able to put your hands on the patient, you're going to be a little limited. So that restriction should help help you out there. Now, you can also select your codes based on a couple of different options. And just for a little background, there are already changes that are in the works to release for 2021 to how the time is rated, and also the MDM guidelines will be updating. But for right now, the MDM guidelines are going to remain the same. But for time, they did offer some new guidelines to give you a little flexibility to help with these. One of them is time is defined as all the time associated with that particular visit on the day of the encounter. They do specify it needs to be timed by the provider and not necessarily by the staff. So if you're reviewing previous lab results, following up on anything maybe that's not patient facing, that's still time that you can include towards selecting the appropriate CPT code for that visit. Again, just good to point out, it does not have to be face-to-face. It may or may not consist of patient counseling. I did go ahead and throw a link in there to that interim final rule. Pages 135 through 137 really talk about this more in detail. So if you want to look a little closer at it, that's a great place to go for some quick information. All right, so let's talk about how we can do this quickly. So we'll talk about our Medisoft and LITech MD users here first. So if you already have a progress note template, you may or may not know you can copy that and create a new template real simply. So in the slide deck, we just kind of review how to get into those note templates. And once you're in there, you can just do Control-A to highlight it all. And then go out on the right side, you'll see there's a button that says New. You can click that and do Control-V like Victor to paste that in. From there, you might just want to change that title from Office Visit to Telehealth Visit, and make any additions or changes that you would like to include in that as well. So again, I just gave you an example. You might want to update your telehealth visit with vital signs. If it's something you feel like the patient can report those to you over the phone, if they have the ability to give you their temperature, blood pressure, that sort of thing, you can record those, but you won't be pulling them necessarily from the other parts of the chart there. You can also take that time to update your physical exam as well. And then, I'm sorry, I went too quick. So once you get all those finished, you can just go ahead and click to save it and give it a new title for telehealth. That way, when you're doing these telehealth visits, you can select it. You'll already have that verbiage in there in your chief complaint, and you'll know that your physical exam is ready to go. So if there's certain areas of the physical exam you won't be covering on a telehealth visit, you can remove those right from that telehealth visit before you save it. Okay. All right, so let's talk about NextGen users. Another way to save you some time is going to be using the blueprint option. So I'd recommend pulling up one of your test patients and starting an encounter. And then go ahead in your chief complaint section where there's the note part, and you can put in your line there about it being telehealth, having the patient consent, that sort of thing. You may or may not choose to go ahead and attach some of your codes. You even have the option of adding the modifier for those types of visits. Again, you can adjust your normal physical exam, lots of options there that you would have with a blueprint anyway. And then once you do, when you're in that encounter preview, you can just click where it says to save as a blueprint, and then just go ahead and give it a name and a description. Then in the future, when you see a patient and that encounter opens up, you can click on Grand Central and then just pull that template in and select all those items that are pre-checked, and they'll put right in, and you'll start your note with a good jump start on it. Again, if you need any help on that, let us know. We're happy to walk you through the process there. So now we have a poll for you. I think Liz is going to go ahead and launch that for us.
You got it, Maggie. Go ahead and get this up.
Wonderful. So we just kind of want to see where you're at with this right now. If you've updated some documentation, if you need some help with it, just let us know maybe which product you're looking at. Or if you're opting not to update any of the documentation and just use what you already have, or manually making those changes as you go, we'd like to know that as well. So we'll give you a few minutes on that. Hopefully these tools will help speed up your documentation. Likewise with both products, either by creating a blueprint or making an additional template. If you choose to do telephone check-ins or any of the other types of visits that Lori spoke about earlier, you can create a real simple template for those as well. Again, by copying what you already have, there's a lot of good content that you use. You could make really simple additions. So you could also consider if it's appropriate for your practice to include a COVID screening into a template, just to ask a few basic questions, you know, about fever, cough, that sort of thing. Any addition like that would be appropriate. So Liz, just let me know when if you feel like answers are still kind of coming in, and then I'll turn the time over to our next presenter.
So it does look like our answers have stopped. I'm going to go ahead and end this poll here. We are showing that about 51% have said that they've already updated theirs. So I'm showing 26% say that they are using Medisoft Clinical, Lytech MD. We've got about 20% that said no thanks, I don't plan to add any other special documentation. And then about 3% said that they're using NextGen.
Okay, office, great, thank you.
All right, so we're going to move on to just to review some of the billing guidelines and the big changes that have happened there. And we had some good information shared just in the chat that we're going to cover. So this was all late breaking, right? Because when everything happened in March, the first information that came out had to do with how to bill telehealth, and everybody was kind of going off the guidelines that were already out there and everything like that. So the interim rule that was released last week at the end of the week made some significant changes to that can affect your reimbursement rate. So it's important to be aware of that. So what changed is before they wanted you to put your place of service as an O2, which would indicate that it was a telehealth service. But during the pandemic, they've changed that to clarify that they want you to use the same code you would have been using if you were doing a visit in the office. And again, beyond just the office visits, they've really expanded that list of services that are available for you. Over 80 additional services have been added as of March 30th. So use the appropriate code for what you would have been billing before, and then you're going to put the place of service equal to what it would be normally. So if that's normally in the office, a place of service 11 code would be what you would use over the O2 code that was out there before. And then the way that they're going to kind of track to see that these were related is that you're going to use the modifier 95 now. So that's a big significant change because again, it affects reimbursements. The reason why that's important is you can see on these two charts, these are just the office visit codes and what you would typically get reimbursed, like the national average, if you were a non-facility versus a facility. So you can see just probably not a common 99213. If you were using place of service code 02, then that was getting reimbursed at the facility rate, which would be the $52, versus if you code it now with the place of service that you would typically be doing it at, like your office visit, office place of service code, then you, with the modifier 95, you would be reimbursed at that higher rate. So if you have already billed for those visits, I would recommend contacting your carriers and resubmitting claims, doing a corrected claim so that you can make up that difference, because over the number of patients that you see in a month, that could equate to thousands of dollars. So just wanted to again get that update out there. So beyond that, there are a few other telehealth related modifiers. I'm not going to go into big detail about those, but just wanted to you to see that there are some that may apply to you, probably not to the majority of our clients, but we will again have links to get you the detailed information. In addition to that, there has been the new diagnosis code, the new ICD-10 code. Was released. It was supposed to be effective in October, but they sped it up, and that was made effective as of April 1st. So anything, if it's a confirmed diagnosis for COVID, they want you using the new code for that, and there's some direction on if it was patients that were seen before April 1st, the codes that you could use for that. Probably, for most of our practices, you're not going to be necessarily diagnosing them. So the ones that would be more relevant to you would be for the known exposure, possible exposure, or that you were doing a screening, or that they were suspected of COVID. So there is new guidelines that were released that will give you details on that. And again, this is a quick summary of it, but there is a really nice document that CMS has put out there that's an easy read that gives a little more detail so that you know exactly how to when and how to use those codes, right? This is one of the greatest resources, and I'll be honest, I kind of had a heart attack last night because I'm like, oh no, that everything is changing so fast. Like yesterday, it said updated as of April 1st. And because there were so many changes that happened with that interim rule that was released on March 30th. And so it was still up there, but it had the latest update, and then they took it down, and I was like, oh no. So they've really done some great work over at the AMA. This is just one sample screen. If you haven't seen this guide yet, it is fantastic because it walks you easily through. I'm only showing like scenario 4, but you can see here's another one of the common scenarios, but it easily walks you through the different types of scenarios. And I believe there's over 14 or 15 that are out there, and then it will tell you like, here's the applicable codes that you can use, and then you know, the down to the place of service and applicable ICD-10 codes. So it really does a good walkthrough of how to code for the different types of visits that you may be experiencing. So, and just to point out again, you know, it'll walk you through if it's a patient suspected of COVID versus this is just a regular telehealth visit because it's not a COVID patient, right? So great resource there. And again, we'll have links to that full guide so that you can keep that close when you're doing these telehealth visits. But I'm going to move on. So, oh, actually, before I do that, so I did want to, again, just make that point that even though they've lifted those restrictions to say you can use a telephone if you need to, you'll see on this particular chart, like which codes you would be using if it was for a telehealth visit versus just a telephone visit for those E&M visits. And again, the reimbursement rate is really what is significant there. So if possible, try to do the telehealth option over just the phone option because better for the patient and for you as a provider, and providing the best care as well as the reimbursement rate on that. So we mentioned in the beginning that the different types of telehealth that are available. So you can be capturing revenue for all the different ways that you're communicating with your patients, whether you're doing that telehealth visit, which is going to be, again, the highest reimbursement rate, or if you're doing those virtual check-ins, calling them by phone or communicating to them through email or text or things like that. You can see there's still some reimbursement for that as well, although not as high, obviously, because it's a different service that you're providing there. And then for the e-visits where the patient initiates that contact with you, and you know, they can communicate through the portal with you, again, the reimbursement rates there are going to be a little bit different as well. So so that's you've probably seen this chart all over the place out there because it's part of this great provider fact sheet that CMS released, but I just wanted to cover those. So one other announcement that they made that was a recent announcement had to do, and you can see this was on April 7th, had to do with in response to the Family First Coronavirus Response Act. They have now for Medicare, for any of the visits that are related to COVID-19 testing or evaluation to determine if someone needs a test, they are lifting cost sharing. So patients will not have to pay a deductible or co-insurance or copay. Again, this is for Medicare, and many of the other payers are following suit. But what they want you to do on those types of visits is to apply Modifier CS, which means that that it's a visit that the cost sharing would be waived on, so that you get the full reimbursement from from Medicare for that. So instead of collecting that copay from Medicare is going to cover that copay 100%. So the money will come from them. So wanted to point that out. Now they did make that retroactive as well. So if you have billed any types of claims that would have been applicable for, going back to March 18th, then you can, again, contact the payers and resubmit those claims for correction so that you can get that higher reimbursement. So now that we've kind of covered all that side, we still need to talk about how do we collect from patients during this time. And we're going to turn that over now to another special guest, Tony Peterson, who's here from NextGen. So Tony, I'll turn it over to you.
Can you hear me, Lori?
I can. Thanks for joining us.
No problem. Thank you for having me. I am going to share my screen here. I apologize that I can't share the video. My computer died right after we went into our stay-at-home order, and the computer repair shops are all closed here. So I'm on a desktop with no webcam, and I think that it's probably better for everybody involved if you don't have to look at my face while we go. Lori, can you see my screen now? Is it sharing?
Tony, we can see your screen.
Sorry.
All right. So very good. Thank you. I want to start with a couple of slides, and then I'll show you how you can apply what we talk about in an integrated manner with your software. Lori gave you a lot of really good information about how to bill for the telehealth visits and the different types of interactions that you can have with your patients in order to try to keep your businesses going and financially viable through the national emergency. And on the slide that she just showed, she talked about how the co-pays and deductibles and all of that would be waived during the national emergency. What's really interesting is that a lot of doctors and a lot of practices that we've been interfacing with read that to mean that all cost sharing has been suspended during the national emergency, and that's actually not accurate. With Medicare and with a number of other payers, your deductibles and coinsurance is still going to apply in most circumstances that are not related to COVID-19. So if you're doing an E&M visit and you're interacting with the patient just on a regular management of their health and routine care, their coinsurance, their copays, their deductibles are all still going to apply. And with most healthcare today, the patient's responsibility makes up about 50% of the dollars that are there for each claim. It's really interesting because a lot of doctors have been saying that they don't want to bill their patients right now. There's a national economic emergency as well as a health emergency. A lot of people have lost their jobs. Everybody says that they don't have money. And a couple of points on this slide I want to point out to you, I think are very important as we go through that conversation. Many of your patients still have HSA or FSA funds that are set aside for healthcare. And so they need to continue paying for their services. For your practice, and really any practice to function, you have to continue to generate revenue. In order for your staff to continue working, in order for you to continue working, you need to be able to provide for your families, provide for your employees, and that revenue needs to continue flowing where it's possible. You need to get paid for your work. BillFlash, which is the company that I work for, we will allow you through our system that's integrated with most of the softwares that you're using to send patients their statements and receive payment from them without anyone having to leave their home. Most of our customers, most customers out there today, the patients pay their bills largely when they're standing in the waiting room. Well, if you do a telehealth visit, you're not necessarily going to have them standing in the waiting room waiting to make their payment of both their copay and their outstanding balance before the visit starts. The equivalent of that is to bill them for that and make sure that they pay it before the telehealth visit. Or if you submit the claim and it's applied to the deductible, you need to send them statements and bill for that after the visit occurs. You need to continue getting paid for the work, and you need to find ways to do that remotely. And if most of your payments have come from in-office swipes or checks, you need to find the way to replace that in order to get the revenue side of the equation. At the beginning of this, we've talked about how to provide the care. What we're talking about now is how to get paid for that. Another very important thing for you to note is that PCI compliance is still required during the emergency. Those regulations have not been relaxed at all, which means that how you process credit cards is going to be very important. If you took a call from a patient, a phone call, and had a visit that way, and they gave you their credit card over the phone and you wrote it down, that would, in most circumstances, not be PCI compliant. So you need to make sure that you're collecting that revenue in a way that does not get you in any regulatory trouble with any of the entities that have regulatory oversight over the healthcare industry. And that includes the credit card companies. So how exactly does BillFlash and the solution we're integrated with AZCOMP allow you to do this? Well, if you are utilizing BillFlash, you can email a charge to patients prior to the visit that allows them to pay that visit online prior to their telehealth visit. So if they have a copay or an outstanding balance that you'd like to receive, we'll let you do that. In an electronic way, they can pay from the comfort of their home. And in a lot of circumstances, it integrates back into the practice management systems that you use. After the visit's completed, we'll allow you to send same-day statements to patients via electronic delivery methods, like sending them an electronic email or a text with a notification of a statement that the patient that can then go and view online. We also allow you to set up automatic recurring payment plans that start on the date that you select with full PCI compliance. What that really means is that if you'd like to work with your patients, if they're experiencing economic hardship, you want to spread those payments out. Not only do you have the ability to do that in a way where you store that card on file and have it automatically charge every month, you can even delay that, similar to what a mortgage or a car loan company or a credit card company might be doing with some of their customers during the national emergency. So if you wanted to start the patient's payment plan on August 1st, you'd have the ability to do that. We'll also allow you to store payments on file for automatic payments, which allow those patients who still have the ability to pay, they can set it up so that their healthcare bills are paid as soon as the statement goes out automatically, the same that they may pay a lot of their utility bills or their cell phone bill. Setting up an automatic payment means that it's a lot easier for that to be collected, and then it'll roll right back into your practice management system. And in order to make all of those things work, we allow the patient to store payment methods online in a secure, PCI compliant manner, so that you don't have to worry about whether or not the way that you're processing those credit cards remotely is PCI compliant. If you utilize BillFlash to do that, that's included and taken care of for you. So I'm going to show you real quick here how that works. I'm going to be doing it from within Medisoft, but I actually am going to change up the demo a little bit today and show you how the patient would interact with you first. So with BillFlash, there's a couple of websites that you need to know of. First one is myproviderlink.com, which is where patients would be sent in order to make their payment to you or on the account. I'm logged in as a patient here. Please know that we have the ability using MyProviderLink to accept payments from patients without having a login. So if they receive a statement, all they need is their chart number and a form ID, which is on every statement that goes out if BillFlash payment services are included, whether that be a paper statement that shows up in their mailbox or an electronic statement. It'll give them a form ID, and I'll show you here real quick on that statement. Right down here, there's the form ID, and here's the chart number. Those two values will let the patient make a payment to you without even needing a login. So if you're worried about having to manage patients' usernames and passwords, them forgetting it through all of this, you don't have to worry about that. We make it very easy for them to pay if they don't have a login. Now, I'm on a patient that does have a login, and as you saw, when they log in, not only will they be able to take a look and see what their statement looks like, they'll have the ability to pay it, which is really what we want them to do. So if I'm James Dugan here, and I'm with Happy Valley Medical Clinic as my provider, if I get my statement for $130 and I want to pay that, I can click the pay button right here, and I'll be brought to a screen where it's very easy for me as a patient to go through and pay for the care that I just received via telehealth or through the statement that was sent out after the visit. I can either pay the total amount of the statement that's due. I can pay another amount if I'd like and type that in. I'm just going to take the total amount that's due. I can utilize the stored payment methods as a patient. And then all I have to do, if I wanted to choose a different one, I'll just show you that real quick. You can do both credit card or an electronic check. Either of those they have the ability to pay with. But if I choose my saved method on file and hit submit, what you'll see is that the patient will be given from the comfort of their home a receipt for the payment that they just made. And then if you're utilizing a practice management system or an EHR that is integrated with BillFlash, those are going to come right back in to your system. So I'm going to show you how it works in Medisoft. We're integrated with Medisoft, Lytech, a number of other systems. And similar to UpDocs, if we're not integrated, all of this can function on a standalone basis. But I entered my $130 patient for James online. James, the patient, made that, got the receipt. And if I come in here into Medisoft, into my deposit list and click this little button that says ePay, you'll see that James's $130 payment shows up right in the deposit list, ready for me to apply it to the charges. So you've made it very, very simple for the patient to make that payment online without ever having to stand in your office or mail a check, interact with anyone. BillFlash really does support social distancing and flattening the curve as we go through the national emergency with this pandemic. So we talked about a couple of other things that BillFlash is going to allow you to do. I'm going to come back over here and, well, actually, I'm going to show you how you can get those statements up in BillFlash. Many of you might already have it, so you know how this works. If you don't have it within Medisoft or any other integrated system, if you go to send your statements, there's an electronic option. You can send those right on up. It's integrated. It'll launch into the BillFlash module where you can then review those statements, approve them, add notes to them. I'm not going to spend a whole lot of time on this particular interface because this isn't really the piece that I want to talk about and focus on today, but just know that you have the ability to customize these statements very easily and change the color, change the message, whether it's going to paper mail or electronically through email, adding notes to all of them. It's very easy for you to do that. What I want you to also focus on, though, is those other things that we talked about. If you have patients who are experiencing economic hardships, we have James Dugan right here in our list of payers. A payer with BillFlash is a patient in most circumstances. BillFlash is focused on the patient side of the collection, so a payer is a patient, and usually, sometimes it's a guarantor. But if I come in here in my BillFlash interface to my payers, you'll notice that I have the ability to set up stored pay, auto pay, or plan pay. I'm going to show you how that would work with auto pay. If James Dugan is my patient here and he is authorizing me to automatically charge his credit card for up to $100 for care, all I would need to do is come in here, enter in the information for the credit card, including the expiration date, zip code, and card number, the maximum amount. If I submit that, when a statement is sent to BillFlash, that statement's going to automatically be paid as long as it is $100 or less. If it's a $20 statement, then a payment would automatically be made using this credit card that you enter right here for $20. If it's $120, it's going to be a $100 payment that is automatically made, and then the patient would get a statement for the remaining $20 that were there. If you make it very easy for those patients who are still able to make those payments, make it automated for them, it increases the likelihood that they're going to pay and reduces the amount of work that your staff or your billers have to do in order to go chase that money, which is very important as everybody's working from home at a somewhat reduced capacity right now. If we come back over here and take a look at our payers, I'll show you how to set up a plan pay. It's very similar to an auto pay, but plan pay was what we were talking about earlier. If we wanted to go through and our patient was going to agree to $1,000 payments on a monthly basis, he had a $10,000 bill. It's 10 payments, and we have the ability here to define the start date for those payments. So if we have someone that was laid off or experiencing an economic hardship as a result of the pandemic, we could say that we're going to delay the start of their payments until August 1st, And then starting August 1st for 10 months, every month on the 1st of the month, $1,000 or whatever amount you specify there will be automatically charged to either the credit card or the checking account that you specify. So what we want to do with these different solutions is not only make it possible for those patients to, and likely for those patients, or more likely for them to pay from home, but we want to give you options that allow you to be flexible with those patients in meeting the financial obligations as everybody goes through these unprecedented times. So if I go back and wrap up, there's a lot of different things that are going on. We've talked about it. You need to understand your options. You need to make it possible for your patients to pay online. Offering them the online payments support social distancing while maintaining the financial viability of your practice. And if you have any questions about any of this that you saw today, you can submit your information in the webinar chat, the polls that we've talked about, or if you contact your AZCOMP representatives, they'll be able to set you up for that. One interesting thing that's going on right now, if you are new to BillFlash, if this is something that you haven't utilized until now, we are a month-to-month service. You don't have to sign a contract. If you don't use us for a month and you don't like us, you can get out with no questions asked, no money lost. And if you sign up now, it says March on there. This has actually been updated to April. I need to update the slide. But you can send your first months of statements by only paying for the cost of a stamp, or 55 cents for each paper statement that you send out, 25 cents for each electronic statement that goes out. So it's a much more cost-effective way of sending those statements than using a printer and sending it with envelopes, paper, ink, time, stamps, and all of that. So, Lori, I'll pass the presenter back to you. And if anybody has any questions, refer them to AZCOMP.
All right, thanks so much. And thanks for staying with us, everybody. I know it's been a lot of information thrown at you. I just want to point out that the best place to get access to all the resources that we've been using for this, and believe me, we are very vigilant about using direct source documentation, so directly from CMS and all the news directly from the government. If you go to AZCOMP.com, there's an option to visit our blog, and under the blog there is a wealth of information there. But the one that is constantly changing, I know I saw in the chat a bunch of questions about, are you sure about Modifier 95? Because just last week CMS told me, well, that was true just last week. It was not until I got in Monday morning that I had emails from CMS saying, hey, we had to revise these documents because that's a big change, right? So if you go to the blog and you look for the telehealth expansion, billing and testing for COVID-19, there's a detailed article in there, and it has date by date the announcements that were released. So look for those latest ones. We've got a great video that CMS put out this week as well, that also gives instruction on billing. It's only like 16 minutes, but confirms some of those same things in there. So I'm going to do a quick poll. I know the common question we get is like, well, how do we get emailed when you post things on the blog? So real quick poll. We're not going to share these answers or anything like that, but if you need us to add you to the blog notifications, so when we're posting these changes and things like that, Liz is going to launch that right now, and just indicate if you need us to add you to that, to the blog emails, and we'll get you added. Liz?
And that poll should be running right now. We're just going to give that a couple seconds here.
Okay, great. All right, and then while that's running, we're just gonna wrap it up. We went a little bit over time, so we were trying to answer the chat questions as they were coming in, but if there's additional questions in there, we will try to reach out to you on an individual basis to get those questions answered for you. And again, to send information out following this with the recording as well. So one thing that can help us help you is we talked about a few different things in there. If you're interested in UpDocs, you heard that through AZCOMP you can get that promotional pricing right now. It's $49 a month, and UpDocs has done a great job of lifting no long-term commitments or anything like that, but that pricing is good for the next 6 months if you choose to stay beyond COVID. And in addition, you saw that BillFlash has some great offerings right now as well. So if you're interested in any of those services, Liz is also going to put a poll up there so that you can let us know. You will have the option I don't remember if Megan talked about it, but the time that it takes to get set up with UpDocs is very minimal. So we can even typically, I believe, Megan, if you're still on, she might have had to drop off already, but they're able to do that within hours if you want to do just a self-registration, everything like that. So if you're interested in that, if you're ready just to sign up, you can just indicate that that's the case, and we'll send you that direct registration link. If you'd rather get more information or even a one-on-one demo or anything like that, you can also indicate that, and we can have somebody reach out to you. If you are currently on UpDocs right now and you just need to add services, that's an option as well. I know some of you may be using it just for the patient portal side of it, but may be interested in getting the telehealth option as well. And then for BillFlash, again, if you want to indicate on there, if you're just ready to sign up, we can get you that information directly so that you can get signed up right away versus if you need us to contact you to answer additional questions or anything like that. So thank you guys so much for attending today. We will do our best to keep you up to date. And again, on the blog, I felt like I had to rewrite that whole blog because so much changed with that interim rule when it was released. But our commitment is that we will continue to stay abreast of all those changes and keep those updates coming to you as quickly as they're happening.
Hey there, if you want more videos like this, we have a host of webinars scheduled to help you as you navigate through this time of uncertainty during the COVID-19 pandemic. Check out our webinar schedule on our website. You can find this at www.azcomp.com/events. Thanks for watching, and we'll see you on the next one.